Well, I have champagne. Hey guys, it's Ted Bogert. Welcome back to the Ted Show. I do have some champagne today. Why not? Every day is a celebration. I'm very excited to have these two gentlemen on the show, James P. Coqmard and Jacob Kelly. James and I have been trying to get a podcast episode shot for a long time. He's a very patient and kind human being. I appreciate your patience, James, so much. They're here to talk about a lot. They do a ton in our community and the global community, which we'll talk about. Education Reinforcement Association. They just opened a clinic. Like they just did their first clinic. There's so much that they do, so much good in the world. So I'm very excited to have you both on the show. Welcome. How are you today?
Hi, good morning.
I'm good.
Good morning. Good morning. All right. So I told you before we went live that the audience likes to know a little bit about you. So we'll start with you, James, and then we will then talk about Jacob and his background. Then, a little 411, why, where you're from, why you're doing what you do, that kind of stuff. So take it away, James.
All right, my name is James Philip Coqmard. I happen to be Haitian and I live there. That's where I run a grassroots project, a non-profit organization that's provide free education to kids in the neighborhood, in the community. And also we provide a lot of amenity like for people into the community, like potable water distribution, education. And I'm in a philanthropist, so I study linguistic and law. So, but I do have a lot of certificate in leadership. I happen to be one of the State Department scholar back in 2019. That's when I was like in Orlando meeting with Timothy McKinney, Clayton Ferrara, who won such a wonderful organization in the States, such as Ideas for Us and United Global Outreach. So I've been going back and forth in Orlando, especially in the US, in Orlando. That's where I met with Ted, and I've been running this organization for the last 10 years in Haiti.
Wow, amazing. Thank you for that. I think people don't realize how much work goes into that kind of effort and all the things that you're doing in the lives that you are changing and impacting. So I'm very happy to have you on the show. Jacob, you're new to me. So tell us, Jacob, tell my audience about you.
So my name is Jacob. I studied medicine, and I studied medicine in Navy and the University of the State. And it's a pleasure to be part of ERA. So my friend Crockmar, we've been friends for a long time, and if I've always been inspired by his work. And he told me on September last year that he wanted to open a medical facility, and he said that he really wanted me to join. And I know about the work that he's doing, and the community is providing water, electricity, and education. And I said, this is a really big project, and I really want to be part of it. So I told him, why not like try to reinforce the health system, because Haiti is going through a lot right now. The hospital of the state is closed, and a lot of them are closed. And I said, this will really benefit the population. And I have the ability, we have the facility, why don't we do this? So we start working, and we worked a lot looking for sponsors and looking for instrument. And we did open the clinic last Saturday, and it was a really big beginning. So this is a really big thing for the community. It's a really big opportunity, and to provide health, it's a precious thing.
Beautiful. I love that. Thank you for that. I think most people don't understand they might have read about it, but we're all kind of desensitized by the news because there's so much going on in the world. Tell us a little bit about the situation. Why is it important that we get behind what you're doing? I mean, I know why it's important, but explain the why. What is happening there that is so critical, that is so devastating, that you need to come in and you want to come in to help the people?
Well, as I usually mention to my sponsors or donors or whoever that I met or network with, it's a human right to have such possibility to just have like healthcare, education, And as you know, Haiti is going through a lot of crisis for the last 30 years. Since I was born, I never know that Haiti had a break. We went through too much as a small country, as probably the first black nation in the world. We went through too much. We went to a dictatorship. We went to several coups. We went to one of the major earthquake in 2010, a lot of other hurricane, and most devastating thing is the political leadership that keep going down, that keep decrease, and people are fighting over each other for power, and the lack of leadership of our government and the lot of resources are putting Haiti in a difficult situation, which impact or affect the health system, which affect the education system, and affect the whole living community. And remember, Haiti is a country just like any other country, but we are really far behind. And when I was like in high school, they used to call it like a third world country, but I don't know how to describe it right now because people don't really have access to the basic healthcare system, to the basic education, to potable water. So there's a lot of needs here, and one of the things that people don't realize, I know there's a lot going in the world in other countries, but I want to praise people not to forget about Haiti because we are like 1 hour and a half from Miami, which is one of the biggest city, one of the most luxurious city that I visit. But Haiti is one of the poorest country in the Caribbean hemisphere. So I keep begging people, praising people not to forget about Haiti because there's a lot of that we can do if we want to help, if we want to support. So that's why we are behind all of these initiatives where we can impact more people's life and make it better for everyone. And having Jacob joining us on the team, as I'm not a physician, I'm just a maker. I make things happen, but not having the expertise on specific field. I network with people all the time, and I tell them what I wish to see, what the dream is about, and I connect with people who are expert in this field. So we make them happen. Like potable water, like education, and now we do have like a facility where we provide medical services to this physician who happened to be a good friend of mine. So there's a lot that we're gonna provide, but lack of resources put us like in a slow motion, which I don't really like because I wanna do things fast, so to move to the next thing because real life people depend on the work that we are doing here.
They do. I feel like thank you for sharing that because it's easy to pass by a newscast where they're talking about it or a post on social media, but when you have two faces who have been there and understand the struggles in real life and real time, it makes a bigger impact. And I also want to ask because anything that I've read about Haiti, for you to go in and provide aid, there's dangers involved, right?
Yeah, certainly. Situation is really chaotic, but people are still there, living there, and they need help. And the struggle is real. The struggle is real. People are really dying because the biggest facility in Haiti, they call it l'hôpital général, it's not working. It's not working, and people don't really have a lot of money to go to facilities that are really sophisticated. So the population is really struggling with health and with education and food. So we really need to strengthen our basis so that we can strengthen the population.
Yes. So what can we do here to support you? If somebody's listening and going, because I know I've done podcasts when the one of the storms hit, something happened in Haiti. And I remember we did a lot of podcasts where we were spotlighting people who were providing resources or trying to get in to the island to provide resources. This is several years ago. What can we do here? What can I do in Orlando? What can the people across the globe who are watching? What's the best way for us to help you all in your efforts?
Well, at the moment, as we just start the medical facility, so we want to save more lives. We want to provide more services to the people in our community and abroad. But we are like asking people to help us raise money or donate to our link below to UGO, which is a sister organization based in Orlando that we've been cooperate with for the last 10 years. So we want to buy an ambulance that we can just pick people in danger places where we can save more lives, as we are working on different other projects such as water distribution, such as education, but we really want to save more lives through our action projects.
I love that. So what does somebody do? Do they reach out to you, James? Do they reach out to you, Jacob? How does somebody really who says, I want to give, or maybe they've got a resource, what should they do?
Well, we do have a US phone number where people can just contact us directly and find out how they can help or they can support such of initiative. But
well, we think they probably got a phone call. So what I want you all to do is reach out to James and Jacob. You can use the website. I'll provide the phone number in the contact or comment section below. James really has a heart for helping people, and I know Jacob does too. The situation there is dire. It has been for a long time. So if you have a heart for Haiti, a heart for helping people, you have the resources to help them with the ambulance they want to get. I mean, their needs, we're talking about basic human needs that they want to help people, help the Haitians. And it is dire. If you've been there, you know. So big thanks to them. And thank you guys for being here. We'll see you soon. Bye, everybody.